Can using less weed give better results? Here's why microdosing is definitely worth a try. Today, we're talking about microdosing. Microdosing in typical medicine is taking about 1/100th of the amount that you would typically take. Now in cannabis, that's not at all what we're talking about. It's usually about 1/10 or maybe even a little bit more than that. So if you ask Blake, he's always like, it's not really microdosing, it's low dosing. But let's talk about microdosing cannabis. When, from a pharmaceutical standpoint, what are the doses associated with microdosing?
I'm looking at 1 milligram of THC, maybe, and then up to 2.5 milligrams of THC.
You feel like it's up to that head change, right? Anything below the head change, you could consider
is that
kind
low
of
dosing, because everybody's so different.
Yeah.
That
I mean, I think I know some is a little higher or lower than
mine's probably
else's.
A little lower.
Yeah.
Like half of a milligram is probably what I'm looking for if I'm going to be microdosing.
So, and you know, somebody like me might be in the 4 or 5 milligram range, and I certainly know people who are in the 20 to 30 milligram range without getting high at all. Do you have patients, Cliff, that are utilizing this low dose, this microdosing in behavioral therapy?
Absolutely. I mean, the low dose is so important because a lot of patients really have maybe never used before. And if they have, they haven't really had the education around how to use it medicinally. And so, especially, you know, higher THC levels are going to probably cause a little bit more anxiety, a spike in anxiety, especially if they're not, you know, a professional in using it. So when we're really doing trauma-focused work, you know, higher CBD and lower THC, low dose THC seems to be more effective when we're doing mental health therapy.
Sure. So we've talked a little bit about what microdosing is, and I'd like to bring up why I think microdosing is somewhat important. In the endocannabinoid system, there's something that's being talked about more and more. It's called endocannabinoid tone. And it's like working out, like we talked about in another video about sleep with you, Cliff. And you had described, you know, working out at the gym, 3 sets of 12, and getting that, right, that the muscle tone, essentially. You practice good sleep hygiene. And endocannabinoid tone is that same thing, introducing cannabinoid therapy or cannabinoids into the body and increasing the body's tone for that. And microdosing is the ideal way to do that, right? When it comes to microdosing in patients also, when we're treating mental health issues, anxiety tends to be much higher with high doses of THC. And so is that just another, not only for beginners, but another reason to microdose with behavioral health?
Absolutely. So a lot of my patients, they're in therapy doing the work. They don't want to avoid the pain. They're there to talk about it. But at the same time, you know, they don't want to just get high. And so there's this kind of middle ground with a lot of my patients when we're doing mental health treatment, PTSD treatment, focusing on trauma. The balance seems to be, you know, the less THC and the more CBD that they can use and subscribe to, the better off they are in facing some of the pain that they come in with, some of the traumas and the psychic pain. And they're not necessarily getting high, which is something that they don't really want to do when they're doing therapy.
Right. What delivery methods tend to work good for microdosing?
Edibles, capsules. You can even microdose with an inhaled form.
How would you do that?
Shorter inhales.
Almost like sips.
Yeah, little tiny sips off of your vape pen or even your dry herb vaporizer. You could microdose that way. Usually,
are you doing this scheduled? A lot of times I'm recommending a really scheduled approach.
So if you were going to do it inhaled, it would have to be probably up to every hour. You'd have to have either that would be difficult.
I mean, I think it works, but I don't. That's not that wouldn't be my go-to per se.
And not
where
when you
an
were
edible
working.
would last 8 hours.
Yeah. And we do have, like, I think Huga makes a 1 to 30 gummy So it's less than 1 milligram of THC to about 25 milligrams of CBD. And it is my favorite one for starting patients with microdosing because it's so easy and they can just take the whole gummy and they don't have to worry about it.
That's the one.
That is the one.
That product that you just talked about is the one that my patients are using to start off in the morning with, use before a therapy session, and then maybe add on a few of those gummies throughout the day. They're also saying that it helps them with focus and concentration as well.
I can see that with the CBD and just a little bit of THC so you don't feel too out of it, and it rounds out the CBD nicely, and the CBD rounds out the THC so nicely. You could probably dose those every 4 to 6 hours and keep on a really regular schedule and not feel too high and not feel too sleepy. Be really functional for the whole day.
If you're looking to microdose, and another topic that we've talked about in some other videos is called layering, where you're using a really regimented oral dose at low levels and then layering on top an inhaled method. We have other videos for that as well that we'll link in the description. Finally, finding your just right dose is probably the most important thing to all of this discussion, and you want to do that first. Finding out where that head change occurs and what's the maximum dose that you'd be able to take without increasing anxiety. You can find our guides at utahmarijuana.org/guides, where you can find a just right dosing guide there. If you have success with microdosing, comment below the products that you're using, what dosing levels you're using, what other cannabinoids you're using in that microdosing. We'd love to hear about it. We answer all of your questions.